You're listening to the Sick and Good podcast. My name is Dustin Messick, RDN. I'm a cancer survivor.
My name is Dr. Colin Goodwin, and I'm a cancer survivor. We're discussing topics related to cancer treatment and recovery while promoting wellness.
To find a balance between sick and good.
And during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regimen.
Welcome to this episode of the Sick and Good podcast. For this episode, we have Sheri Weitz, who's a registered dietitian, join the conversation. Sheri has more than 20 years of experience working closely with clients in both inpatient and outpatient settings, addressing medical conditions through nutrition. She's worked with patients that have cancer, as well as other disorders such as diabetes, eating disorders, and digestive issues. Additionally, Sheri is also a breast cancer survivor, so we wanted to welcome her to our podcast for today.
Yeah. Do you want me to tell my story just to let listeners know what I've gone through in terms of cancer?
Yeah, absolutely. That sounds great.
So because I've been a dietitian, nutritionist for decades, when I got breast cancer, I was shocked and I thought I did everything right. I was the person that ate kale, that did a cleanse every 6 months, ate organically, taught dance, fitness, used non-aluminum deodorant. The list goes on. And people in my support group, same thing. We were a bunch of kale eating joggers. And I was really, really shocked and went through a lot of emotional work when I was diagnosed. And I decided to be the first patient. When they offered me the choice, I became the first patient in the world actually to get targeted chemotherapy for, they call it early stage breast cancer. It wasn't early stage, but it was non-metastatic. When I was diagnosed, I had stage 3 breast cancer. It had gone into my lymph nodes. There was at least 4 positive lymph nodes, and I thought I was going to die. It was extremely scary. And I had more than a year of treatment. I had a mastectomy. I had radiation. I had multiple surgeries. And the chemo was for more than a year. So although it was targeted, I was queasy and felt affected by it for more than a year. So I since have a very healthy life. I do have some chronic conditions such as mild lymphedema. And as they say about radiation, it's the gift that keeps on giving. So I continue to have some symptoms from radiation. But overall, I teach cardio dance and Zumba. I work. I am active and just extremely, extremely grateful. I feel so lucky every single day to have survived and to be able to help patients both with and without cancer and just to carpe diem, to enjoy life each and every day. So I do feel that being a survivor has made me a different person, and it's a part of who I am each and every day.
You mentioned a couple of different things as far as things that you did for your own personal diet, as a kale jogger, as I think you identified
kale eating
as.
Jogger, yes.
Yeah, and that you've done cleanses. I was curious if there's other than preventative measures that you would recommend to make for diet.
So I think if there's one message people can leave here with, it's that old adage, the serenity prayer, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So we can do what we can to prevent cancer, but I think there's also anxiety that comes with that. If I eat perfectly, I'm not going to get cancer, and so I need to eat perfectly. And then if I do get cancer, what did I do wrong? So I really want to make the point that I believe a lot of cancer is environmental and not what we eat. And what we eat has some effect, but emotions are huge. Environment is huge, and eating is a part of that puzzle. It's not the whole thing. So to prevent cancer, I do have some basic recommendations. Are there guarantees it will prevent cancer? Absolutely not. Should you still enjoy food? Yes. Yes. Enjoy food because there's a benefit. I call junk food soul food because it's good for our soul. And so when I was first diagnosed, a holistic chiropractor that I was seeing said to me, don't have one bite of sugar, not even one bite. And to be honest, I stopped speaking with her because that freaked me out. I knew I wasn't going to be able to do that. In fact, because of the reconstruction I had where they used my stomach to reconstruct one of my breasts from mastectomy, my doctor said to me, eat more ice cream, eat more ice cream. So I definitely had some sugar during... Eat more ice
A very
cream.
different recommendation there.
And of course, my family made fun of me because the day before my mastectomy, I ate ice cream and went for a 10-mile bike ride. They said, wait a minute, that's defeating the purpose of the ice cream. You're supposed to gain weight for the surgery. But boy, that bike ride felt good. I knew it was going to be the last one for a while. So my point is that, yes, we can do some basic things to prevent cancer. And knowing that there's no guarantee, why do we do it? Because it also makes us feel good. It also reduces inflammation. So day to day, we're going to feel better if we engage in some basic cancer-reducing dietary practices. One of them being the Mediterranean diet. Those that study nutrition know Mediterranean diet always wins every vote and wins every contest, and every study comes out saying, what's the best diet? The Mediterranean diet. I'm staring at a copy of the Mediterranean diet food pyramid, which I think is a good thing to share with my patients, your listeners. It's a different take on the old food pyramid, and it's just an anti-inflammatory diet in general.
I really like that you included that caveat that kind of the preventative care isn't a guarantee. And it's certainly something that even with these recommendations can be very different and individualistic. I would certainly appreciate the story that you shared about this different recommendations that you've received from medical providers. I think that's another thing to take into account, that there are going to be differing opinions. But with that in mind, I was curious if there's a recommendation you have to then those are active treatment and how that might look different. Or maybe it's about the same, about having that diet that's going to be looking at reducing inflammation. And I'll just hand that mic back over to you.
So, we talked about what do we eat to prevent. We didn't really close that circle, but we can come back to that maybe. In terms of people that are in treatment, it really depends. Cancer treatment's gotten better because it's extremely specific. In the breast cancer situation, is it hormone sensitive? So is it ER/PR positive, or is it ER/PR negative? Is it HER2 positive, HER2 negative? I personally had ER/PR negative, HER2 positive. So that's a different scenario. So are you trying to shut down all your hormones in order to stop the cancer? That is a different situation. In that case, you need to get rid of all animal saturated fat, pretty much, throw that down to a minimum if you're in the middle of cancer treatment. If you are going through chemo, you want to be careful of supplements because they can interact with chemotherapy. So it really depends on what kind of cancer treatment the person's going through. I did share with Dustin, there's some great supplements that can help to prevent neuropathy from chemo. And one of them is L-glutamine. I do recommend that to my patients. And I usually have them take about 5 grams a day. And in order to get enough, you need to do the powder. And that's about a heaping teaspoon a day. And that can prevent neuropathy during treatment. And then if you actually get it, then you would increase your dosage from there until you get a relief. And that's just one of many tools in the toolkit, but that can be very effective for neuropathy.
Yeah, that stuff is amazing. When you told me about it, Sheri, you were like, you should try this. I'm like, I've tried things. I think I'm good. And I tried it, and I've recommended it to quite a few people since. I'm like, this stuff is life-changing. You got to do it. And I probably sounded the same as you sounded when you told me about it. And I'm probably skeptical, but I'm like, no, it works.
Awesome.
So you talking about the supplements, what would you say your approach is to treating cancer patients as like a holistic dietitian?
As a holistic dietitian, I would look at their overall inflammation levels. I would give them things to support their energy levels. So of course, I would want them to eat less animal products, but to be a strict vegan, that's pretty extreme for some people. So if you're going to eat some animal protein, then go for organic meat, go for lean meat. I always recommend EVOO, extra virgin olive oil. So you want to use it in a raw state. So add it to your salad, add it as a finisher to recipes. So I'm big into the extra virgin olive oil as a superfood, as something that's going to reduce inflammation. And always the big C. What's the big C? You're going to think that's cancer, but I'm talking about cruciferous vegetables. That would be kale, broccoli, Brussels sprouts, and cauliflower. Those are the biggies. Just if you can eat as many as possible every single day, then you're getting your big C in your diet. So that prevents cancer and it helps overall decrease inflammation.
I really like that. The big C. I also liked earlier when you said junk food is good for your soul. I was like, yes.
Yeah, I call it soul food because it's good for your soul. Yeah.
Yeah.
Definitely. And that's the thing. I think that people get such anxiety, and people can eat perfectly and still get cancer, die from cancer, survive cancer. There's so much. So I really think it's a blend. And that's why I call myself a lifestyle or wellness coach, because it's not all about what you eat. I attribute my survival partially to guided visualization that I actively participated in. So visualization is really important. Emotional support, hugs, exercise is huge. Exercise has tremendous research in terms of preventing reoccurrence, increasing survival. So whatever people are able to do, gentle movement, anywhere from gentle movement to extreme exercise, whatever they're able to do at their level, either during or after treatment, or before you get cancer, right? God forbid, it's going to be always, always helpful. Movement is medicine. So those are all important, and eating is a part of that. So yes, I always guide people, eat organic whenever possible and minimize your meat and go organic and get your big C's, your cruciferous vegetables, get your extra virgin olive oil. But being perfect, what do they say? Perfect is the enemy of good. So trying to eat perfectly is anxiety producing. And I don't think it's that productive.
It made me wonder, do you have specific recommendations as to how much soul food the patient, because we talked about that, making sure that there's that balance, I suppose, and having the good nutrition, but also then doing what you can to feed that soul, right?
That's always, big challenge. And I deal a lot with eating disorders and compulsive eaters. And so it's really, again, it's individualized. And it can be a tightrope, because for some people, one bite of sugar sends them off the deep end and they're binging. So then I help them to embrace sugar in a mindful way. If you're going to eat sugar, do it without the TV on, do it mindfully, really have every bite count, get the most mileage out of every bite. These are some of my, pearls from doing this for years. So how much is too much? I don't have the magic answer to that. I would say typically most nutritionists give the 1-21 rule. So we have 21 meals in a week. So they say eat one dessert a week. For some people, that's not enough. Some people need a little dessert every day, whether that be some organic dark chocolate or a small cinnamon roll or something like that, in order to feel satisfied if they're eating really healthfully. That's that little thing that keeps them satisfied, that keeps them from binging or going off the deep end. And how much is too much? I mean, a lot of people say, again, one bite of sugar will feed cancer. But for some of these cancers, it's the hormonal balance that's important. So hormonally, beef with added hormones or saturated fat can feed the cancer as much as sugar. And also other people attest to your insulin and your sugar balance. So if you have a little dessert with the meal and your blood sugar is not going up, then maybe it doesn't feed the cancer. So if you can keep your blood sugar balanced, that's a whole other viewpoint. Then maybe a little bit of sweets and sugar is not going to raise your blood sugar. So if I just have a giant cinnamon roll, again, for that example, and that's my meal, I might really drive my blood sugar up. Will that feed cancer? It's possible. If I have a little cinnamon roll at the end of a meal, or if I exercise afterwards to lower my blood sugar, maybe it's not going to have quite the effect.
Yeah, that makes sense, Sheri. And me being a dietitian as well, maybe our listeners have never heard of intuitive eating. And I'm curious, you said that you have worked with eating disorders. What if somebody who has history of an eating disorder is going through cancer treatment? How would they navigate with all this health food information? Would you what would your be recommendation? Because, good food, bad food, all fits food, how?
Yeah, that's a good question. And there's I know you're familiar with this term, orthorexia. And I believe there's even a newer term beyond orthorexia. And I forget the new term. Maybe you can remind me, Dustin. People that have developed an eating disorder because they have a fear of not eating perfectly. And it's about health food obsession, and one bite of piece of junk food sends them into, complete panic. So in fact, one of my most serious eating disorder patients had orthorexia. She was terrified of eating gluten. And in her case, she didn't have a problem with gluten. She was terrified of eating sugar. She was terrified of eating something that wasn't perfect. And the truth is, you can chase perfection, but there is no perfection because everyone's different. And you can eat like a saint and still get sick. So it's really tough to have balance, and everyone's balance is different. But I really believe the intuitive eating is important, and to have maybe one small sweet a day or every other day, if you're eating an overall really healthy diet and you're getting some movement in there, is reasonable. And I'm hoping that some people take comfort in that. And if you're going to have it, eat something that you really, really are wanting, really craving. Have it in a mindful way. Try not to eat it in a distracted way. So the TV's off and you're sitting there with that food saying, okay, I want you. And you're, taking advantage of each and every bite, maybe even closing your eyes and really practicing that intuitive eating and eating what you love and stopping when you don't love it.
Really being in that moment.
Yes.
I wanted to make sure that you had the opportunity to speak to the preventative care and kind of close that loop. I know you said earlier that there's an additional comment that you wanted to make there.
So I do believe I addressed a lot of it, but as prevention, what can we do? There's the environment. So in terms of environment, I do recommend an app that people get. It's the EWG app. It's the Environmental Working Group. They're doing excellent research and they assess anything from a sunscreen that you might put on your body to shampoo, toothpaste, and they do assess if there are cancer-causing ingredients. So that's something that we can all look at. In terms of diet, if you look at the food diet pyramid, you've got sweets at the very top, meaning that's something that we want to have in smaller amounts. Alcohol, including red wine, in moderation. If you go down the pyramid, you've got the next biggest is potatoes and red meat. So red meat is something we want to have less often. Potatoes, the food pyramid says 3 servings a week. Potatoes can raise blood sugar, although sweet potatoes are healthier, but we want to have them, in smaller quantities. Then you go down the pyramid. The next largest amount would be white meat, fish and shellfish, beans and legumes, and eggs. Then you go down further, herbs and spices. So they're saying use herbs and spices liberally. Then the next most plentiful is olives, nuts, and seeds. So I'm real big on nuts and seeds. They're satisfying. They keep our blood sugar from going up. And if you're hungry, snacking on raw sunflower seeds or almonds or walnuts or cashews, if you're not allergic, they're amazing. They really are high in fiber, very satisfying, and they are anti-cancer, really. Then they recommend dairy. Actually, the Mediterranean food diet pyramid has dairy as the second most plentiful. So it's right next to the base of the food pyramid. I know dairy is very controversial. A lot of people are taking dairy out of their diet. So that's something that has to be individualized. I know for me, for instance, I digest raw cheese better than regular cheese. I don't digest milk well, so I do almond, and then I do soy milk. I know soy is a little controversial as well, and that's something that has to be individualized for somebody before they have lots of tofu. You got to look at that. So dairy is on that second rung of the triangle, and if anybody wants to just Google the pyramid diet food pyramid, it's right there, easy to find. So the very bottom, your base of your pyramid is vegetables, fruit, olive oil, as I mentioned. It doesn't say extra virgin, but that's what I recommend, and whole grains. So again, if you are off gluten, whole grains is going to be something that might look a little different. And that might mean I recommend organic corn, things like amaranth, millet, some of your interesting grains, buckwheat, quinoa. That's a great one. Fruits and veggies, we all know, pretty much more the better. I don't recommend fruit juice, but eating your fruit's awesome. And vegetable juice is a great way to make up for a loss of vegetables. Just make sure there's minimal fruit in your vegetable juice, and organic whenever possible.
Okay. Wow. Yeah, that's really good. Thank you for sharing all of that. So how would someone transition into like a Mediterranean diet if they were eating totally different before?
I do recommend working with a registered dietitian, someone with a non-diet approach, a gentle approach. So be gentle with yourself. I would start to stock your house with different things, because if your house is full of sweets and processed food, crackers, chips, that's what you're going to go to. So I recommend stocking your house with, nuts and seeds and fruits and vegetables. And frozen is really convenient. Frozen vegetables are awesome for you. And same with frozen fruit. And you can look for frozen vegetables that have 0 sodium. And there, in my opinion, there should be one ingredient. If it's frozen broccoli, it should say broccoli. That's the ingredient. And those are really very easy to always have there. So I recommend stocking your house full of those things. If you're not a cook, there's a really inexpensive food delivery that I just discovered called Every Table.
Ooh,
and
yeah.
Their meals are $6 and they use organic and whole grain. And yeah, I'm going to actually experiment with getting their foods delivered to me. I have a client he has an eating disorder and he's transforming his eating because he's just not able to cook right now. Just doesn't have to get up and go to actually help himself do it. So that's transforming his eating. So that can be helpful maybe to get over the hump is do a healthy food delivery, something that's affordable for you.
Yeah, I actually did every table for a little while myself.
Okay, awesome.
I was experimenting with all those sort of ones. I tried one of the other ones that was like something chef where they deliver. Every table is really good though. I recommend them as well. I mean, Blue Apron's good if they want to learn how to cook, but yeah, every table's convenient.
And it's affordable. So it's more, and people can donate to them, and it allows people on low incomes to have the food delivery. So they're trying to deliver healthy food into the food desert areas.
Oh, yeah, that's really awesome. Yeah, I also had tried Home Chef, I think, or I think it was Home Chef.
HelloFresh?
HelloFresh, I think, was one I was looking at. Just like, I like to try them out so that I can recommend them to clients, you know?
I must say one of my clients is using HelloFresh and she's learning how to cook. So I say, oh, you're in cooking school, because every night it takes her more than an hour to prepare the meals, and she's a working woman and she's doing it and she's learning how to cook, and she's sleeping so much better because she's eating a balanced dinner now. And it's filled with kale and all these cruciferous vegetables in almost every recipe that they have. But the recipes aren't perfect. They put, drizzle it with honey, so things like that make everything taste good. So I think that their food is satisfying, but I think it's expensive. So every table is definitely more affordable.
Yeah. I'm wondering if those like food services or delivery services are helping with the kind of care that, a cancer patient might need.
That's a really good point. And of course, when I went through breast cancer, there was, I forget the name of the one that we use, but I know that you guys might be familiar with this, where they have websites where your loved ones or friends can sign up, and then they
meal
bring you
train.
food. A meal train.
Yeah.
Thank you. And they bring you food, and that's so helpful. So yeah, I think when that sort of dries up, right, and you're kind of past that meal train stage, but you still maybe don't have the energy to prepare your meals, or just maybe not the motivation. Sometimes it's just hard.
Yeah.
I know for me, I'd rather do an art project or something or dance than be in the kitchen. Then it's nice to have that meal delivery service, especially a healthy, affordable one.
Actually, you talking about reminded me about how I remember during my treatment that a neutropenic diet was like such a big deal.
Oh, yes.
And now I hear it's not as emphasized as it used to be.
It completely changed. So the neutropenic diet was used in hospitals, especially when I was back doing clinical. Basically, a patient couldn't eat any raw fruits or vegetables at all. And recently, when I was working as a clinical nutrition manager at a hospital, I found out that it has changed. So now you can have them as long as you're not eating the peel of the raw fruit and vegetable. So as long as it's been washed and no peel, it's liberalized a lot. So the neutropenic diet is really not that strict compared to how it used to be, which is great because it was so restrictive for cancer patients at the time. I'm sure you went through that.
Yeah, it was. You're just really afraid of the bacteria that's like going to get you sick. Like, that was like the main concern. And then to hear that they're actually, encouraging the raw foods because they realize of the health benefit. It's like kind of the opposite.
Yeah, it's definitely, it keeps changing. As with all nutritional recommendations, it constantly changes, which can be challenging for us nutritionists, but it's just, there's always new research for sure.
Sheri, I was hoping you could speak to maybe some GI supplements or other probiotics.
People do react differently. So it's important to know that you might try a probiotic and it might give you diarrhea, for instance, or it just might not agree with you. So it's important to save your receipt if you buy a probiotic and return it if it doesn't agree with you. In general, I recommend something that's 30 billion or more. That's 30 billion, B like boy, not million. And something that has around 10 different strains. So different strains meaning different bifidobacterium, different lactobacillus, for instance. So the lacto and the bifido have different effects on the body. And it's a very complex subject. Just since I started recommending probiotics, for instance, 15 years ago when I was working clinical, I would recommend probiotics and the doctors would say, what are you talking about? What's a probiotic? So I guess I was a little ahead of my time on that. And then they finally started prescribing them in the hospital and they were 1 million. And 1 million is a lot different than 50 billion. And even now I get patients that say, how's this one? And they show me the label and it's got maybe 1 billion or 500 million, and it's got one strain. And those are the ones that doctors tend to recommend because the drug reps will say, look, this is the one that we've researched. So there's research on more than one strain. One of the ones I use from my wellness pharmacy is called Probiome, and it's got 10 strains and it's got 50 billion, and they're all very well-researched strains. So I do recommend probiotics as something that can help with digestive issues, the immune system in terms of colds and flus and perhaps cancer, which I have not delved into that research deeply. But you have to just make sure that you tolerate it and maybe start with a 30 billion and increase from there.
I think that was a very interesting point that you made about how well you react to it. So Sheri, have you received any odd nutrition recommendations that are considered natural and are able to cure cancer?
I would say the one that says not even one bite of sugar was, to me, anxiety producing. And I don't know that it's odd, but it definitely made me feel very anxious. There are some other ones that I've heard about where you eat the seeds of this plant and it will cure cancer. And I'm trying to remember the name of the plant, and I can't remember the name of the plant, I'll be honest. There's some interesting ones out there.
Did you hear about like goji berries was like the cure all? You need to have a bunch of goji berries every day and then you'll be cured.
Oh, wait a minute. I've got my answer.
Okay.
Because I just had a session with a patient who has stage 4 breast cancer. So we had a session 2 weeks ago, and she was told that raw carrot juice in giant quantities would cure her cancer.
Wow.
So specifically raw carrot juice.
But not carrots. Carrots, that's like, I'm sorry.
It's got to be juiced.
Yeah. Carrot juice. And God forbid you put some really good cruciferous green vegetables in with the carrots. It was just carrot juice, even though that's your highest sugar vegetable. And then when you juice a lot of it, you're actually going to get a fair amount of sugar then at that point. Yeah, it was just carrot juice. So that's what this cancer patient is doing now. So I gave her my opinion about it. But I thought that was an interesting one.
Yeah, there's always a new one. And I agree with you. A lot of times the dietary recommendations can create more anxiety for the client. Like you have to cut out all these foods, which kind of puts them worse off because they get into like the restricting binge cycles. Like, oh, I can't eat any of these foods. So then they become like the forbidden fruit. But
Absolutely.
Yeah. So, and that could be a whole nother podcast, I feel like, just that alone.
One I was going to share was that I had heard that once I was diagnosed, I needed to have shark fin soup.
That's right. Shark fin soup.
I'm like, sure, I'll just go down to my local grocery store. And
I think I saw this place, Shark Fin Soup R Us. I think I just saw that down the street.
Yeah, totally easily accessible and something that is part of my staple diet. I don't know about you guys, but
yeah.
I do snake eyeballs. You know, that's that on my salad every day.
Slowly turning it to Indiana Jones here, and
Wow.
There's always something out there. So I think moderation, common sense, listen to your body, visualization, exercise, hugs, and also eat well.
Sheri, thank you so much for speaking with us on diet and just bringing your expertise to the conversation. So we wanted to just thank you for that.
It's been my pleasure. And I wish everybody awesome health, and you can have cancer and still be a healthy person. And I like the name of your podcast.
Thank
you. Yeah, I think that, what do they say? 1 out of 2 people are going to get cancer. So it can happen to the healthiest person, and you can continue to be healthy during and after treatment. And so I wish all your listeners and everybody wellness. And there you have it.
Yeah.
Thank you, Dustin. Thank you, Colin. And have a great day.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey.